On this episode of Home Helpers Water Cooler Chat, you'll meet a remarkable individual who has dedicated her life to improving the well-being of older adults and their families. Ann Sansevero, president of the Board of Directors for the Aging Life Care Association and founder and CEO of HealthSense LLC, is a true champion in the field of geriatric care. With being a master's prepared geriatric nurse practitioner and a seasoned nursing professional with over 30 years of experience in the field, Ann brings a wealth of expertise to her role. Her passion lies in being an aging life care professional, guiding families through the complexities of aging and ensuring the highest quality of care. Today, we're going to delve into great topics with Ann, from understanding the role of an aging life care professional to finding their services nationwide. We'll also explore whether insurance covers these services and discover if there's help available during those urgent moments when you need it most. Are you ready to learn more about aging life care professionals? Let's go. Hi, Ann. Thank you so much for joining us. How are you doing today?
I'm great, Jonathan. Thank you for having me here.
It's great to have you here. So let's go ahead and dive into it. So the first question I have for you is, what is an aging life care professional?
So, Jonathan, an aging life care professional also used to be known as a geriatric care manager, but that we've changed the terminology. It's a professional that really has a deep understanding of the aging process and is a guide and navigator for those elderly folks that need almost like a quarterback for their aging journey. As you know, these days, healthcare is rather fragmented. There's a lot of specialization among medicine. There has been less communication among the medical fields. There has been shorter stays at the hospital, and that has left older clients in particular having to deal with multiple chronic health issues and coordinate their care, oftentimes when they're in their late 80s and 90s and living into their hundreds. They're on multiple medications. They may be unstable with their gait now and having falls. So care manager is a professional that you can hire to help assess your situation at home, put in recommendations to age better. And they're also available to call in times of crisis or to be a sounding board for any issues. So many people that join this profession have worked in the helping professions. They have nursing backgrounds like myself, or a social work background. Some are physical therapists or occupational therapists, but they all have advanced educational qualifications in a healthcare field. And if you're a member of my association, which is the Aging Life Care Association, we make sure that you have the credentialing necessary for the role that you're playing. We offer a certification exam, and we have very high standards of ethics and guidelines for practice, which is very essential in this type of work.
Very nice. So I can see how this would be very useful for an elderly person anywhere to be able to maintain their independence. So tell me, in the United States, how would someone go about finding an aging life care professional?
So, as I mentioned, I am the president of the Aging Life Care Association. It is a nonprofit association. It has a national reach. There are chapters throughout the country. And on the aginglifecare.org website, you can simply go on that website. There is a button that says Find an Aging Expert. You can put in a zip code, or you can also do an advanced search and put in a name or put in a county, and you can search that way. And what that search engine will do will pull up the nearest aging life care professionals in your area, by expertise and also by closest, to geographic proximity. And you can learn what their specialties are. What are their qualifications? How long have they been registered with the Aging Life Care Association? Do they have particular expertise in a type of setting? Some of us have subspecialties. For example, my background is a geriatric nurse practitioner. So I have a very heavy medical focus, and I do very well collaborating with medical teams. I've helped run medical homes. I have an interest in palliative care. But just say somebody needed a family mediation situation, or somebody to work with the courts for guardianship. Those professionals exist also within our profession that may have a social work background and have a subspecialty in that area, or may have a social work legal background. So we not only have our own qualifications, but we do have special niches, and you're able to see that on the search, which is really interesting. So we often cross refer to each other, because we all have our special superpowers, as it were.
Excellent. And I can tell you, aging life care specialists are worth every dollar because we use several of them in the area here. So thank you so much for that. Now, let me ask you this question. In terms of paying for the services, can insurance pay for services or is it private pay? How does that work?
Unfortunately, regular insurances do not reimburse for this service, which I hope will change in the future, because I really think that it could make a huge difference from a health policy perspective. But currently, there are some long-term care insurance policies that do cover some care management assessments. So if you have a long-term care insurance policy, take a good look at that policy. It's a good thing to do anyway, to know what it actually covers and what kind of care does it cover, what the elimination period is, but also do they cover the services of an aging life care professional, an independent consultant like somebody like us. We will have the qualifications, and if the company pays for it, you can get reimbursed for that assessment. And potentially some companies offer reimbursement for assessments and a certain stipend annually. So that would be a good thing to check if you have a long-term care insurance policy. If you don't have a long-term care insurance policy and you have Medicare or Medicaid, unfortunately, that does not cover the services just yet of an aging life care professional. We do. Many of us will take sliding scale. We price our services really on the geographic area that we're in and the cost of doing business. And some of us have care manager associates as well as the founders and owners that offer slightly lower prices. We strategically try and use our time to the best value of the client. So if you are using an aging life care professional, if you're privately paying for the service, being organized and having as much information on an intake as possible and being as specific with the needs will really help you use the service strategically. And it can be really saving you a lot of money down in the long term, especially with benefit navigation, like trying to help you work with your attorney on doing a benefit application for Medicaid, or trying to help you navigate through a long-term care insurance policy to make sure that you qualify. If you get an expert in this field, it can save you a lot of hours on what is often a lengthy and bureaucratic process, so you'll get the payback that way. I also suggest that if you are in a job where your hourly rate is, get paid a very high hourly rate, but you're spending an enormous amount of time navigating in an area that you're uncertain of, bringing in and investing in a professional that can really strategically help you will be a good long-term care investment as well. The other thing I would finally say, Jonathan, is there's no price for peace of mind, right? And when you have somebody that is your loved one is getting the best care possible, and that you've gotten the expertise to find that, or that person also knows a lot of nonprofit local resources that may be very cost effective for you to use that you didn't know existed out there, it makes it a really worthwhile investment as well.
All right, that makes a lot of sense. Yes, and I did not know that about long-term care insurance, that it may pay for your services. So, yes, our viewers need to look at their policies if they have long-term care insurance. Can we go back to the crisis management? So, the idea of accepting calls or taking urgent calls after hours, is that something that most aging life care professionals do? Is it just some of them? How would I find out?
So many of us will be available to be responsive after hours. It really depends on how you're using us. If you're just calling us out of the blue and want us to go right away to an urgent situation, that can often be very hard to come in at a crisis situation. Obviously, if it's during the week, it's easier. But if it's on a weekend and we don't know you at all, some may be available, some may not. If you have already engaged an aging life care professional, now you have kind of like I call it a black umbrella. You have us in the system with you. We have all of your database. We know what your medical issues are. We know we're in communication with your team. And then if you need to activate us off hours, it's much, much easier for us. We're operating from a level of preparedness. We know what your medications are. We know who the healthcare professionals are that we can advocate, and we can advocate a lot more effectively then. And many of us will accept texts or calls after hours. Some care managers may bill a little extra for the hourly rate because their team members are going to want to be paid a little extra for that service. But we do feel it's very important to have responsiveness in a timely fashion, especially for our older aging adults that may have issues that crop up after hours. Illness does not just go Monday to Friday, 9 to 5. And especially trying to avoid hospitalizations or emergency room visits, it's great to have an aging life care professional that can mitigate some of these problems, like potentially get treatment for an infection early to stop an ER visit. So I would just, when you are interviewing an aging life care professional, if you're interested in service, ask that question of them. Ask them how they handle situations like that. And they'll be very upfront about it.
Okay. Well, thank you, Anne, for all the information that you provided today. I think it's a treat that you have joined us today. So I'm really excited to share this video with our audience. Before you go, I do want you to share a little bit more information about your company, HealthSense, where you're the CEO and founder. Can you share a little bit more information?
I will indeed. So, as I said, Jonathan, I was a nurse practitioner working actually in an acute care neurology hospital, NYU Langone. It's a big hospital center, and I was in their neurology unit working as a nurse practitioner for many years. And I started seeing the rotation of adults and older adults coming out of the hospital back into the hospital for problems that I felt could have been coordinated better in the community. I reached out to the Aging Life Care Association, found out about a group of entrepreneurial support for people starting their businesses, and I started my company, HealthSense, almost 20 years ago. So I started out as an independent practitioner and got a lot of business and mentoring support from my colleagues in this association and organization, and then grew my practice over time. And I now have 7 nurse care managers that work with me. I have a cognitive enrichment division that's a special subspecialty where we do engagement and enrichment for socially isolated adults and those who have dementia. And I also have a benefit navigator who's a social worker who helps counsel clients that need navigation with long-term care insurance or other benefits. So we are serving the Manhattan area, the New York metropolitan area, and I just love the work we do. I think we really make an impact on the lives around us. We're always trying to optimize aging. We love trying to do preventative work if we can, but we're there also in times of need. So that's HealthSense in a nutshell.
Your company is a perfect example of how aging life care professionals can specialize in different services, right? So one aging life care professional may not be the right fit for a particular senior and another one might. Would that be a correct statement?
It would be. There are, as I said, many of us have different types of backgrounds. So, for example, if you have a client who has a serious behavioral health issue or needs counseling and psychotherapy, my social work colleagues that have that as their specialty are going to be a better fit. If you have a client that has a lot of maybe complex medical issues, or you need to set up a medical home, or you need that kind of triage, I certainly might be a great fit for that practice. A lot of us do also, though, look at the bigger picture. We're all experts in kind of figuring out transitions of care, housing needs. We're always able to refer to a really broad resource group, which include elder care attorneys, daily money managers, move managers, and all kinds of resources that we can bring into the home, Jonathan, that are out there. A lot of people don't realize that, like you have a home care company, home is where a lot of people want to be. You can be at home with the right support and resources to age in place. And so we all have a very strong inclination there, as well as advising on senior housing options when that is not an option.
Excellent. Well, Anne, I want to thank you once again for joining us for this episode of Home Helpers Water Cooler Chat. I will provide your contact information in the video as well as in the comments so that anybody who's viewing can reach out to you if they need to. Any last words before we head out today?
Just to say it's an absolute pleasure to talk about this amazing profession. And if there are any of your listeners out there who are in the helping field that may be nurses or occupational therapists or social workers who may want to consider a second career, you should check out our website, check out about membership, check out about maybe potentially starting your own business in this field. There is a huge need for more of us. The aging demographic is exploding, and we need to find more solutions for people to age well.
Excellent. Well, thank you once again, Anne, and to our audience, thank you for joining us. And until next time, stay hydrated with excellent conversations from Home Helpers Water Cooler Chat. Take care.
Thank you, Jonathan.
Thank you.